Thank you for joining us. The webinar will begin shortly. Please enjoy a few words from our sponsor, Ethico.
What would it look like? At Ethico, we've got you covered. Ethico helps ethics and compliance professionals tackle any issue that heads their way, from workplace investigations to case management to sanction screening. Get more connected to your workforce than ever before with our next-gen solutions, allowing you to see key risk areas before they turn into burning fires. Our case management software offers a variety of configurable workflows and automated processes, making sure the right person gets the right data at the right time. Our in-house hotline risk specialists undergo over 160 hours of training to make sure you get more information on the front end. Serving over 7 million employees worldwide, Ethico helps to make our world a better workplace, one company at a time. Visit ethico.com to learn more.
Thank you to Ethico for that great video. Please use the Q&A section, which I see many of you are already using this. You're not a stranger to alchemizing, so you know we love for you to use the Q&A section for your questions and to use the chat to connect with each other and share with each other. Good day and hello to everyone. I see that we've got a lot of folks joining us from around the planet today. So welcome to another wonderful session of Alchemizing HR, Navigating What's Next. We have a couple of housekeeping items before we get started today. As you know, this is a very interactive session. Please use the chat bot to chat amongst yourselves. Tell us where you're tuning in from. Many of you already are. Hello to California and Northern Colorado and Harrisburg, Pennsylvania, Michigan, New Jersey, Illinois, Texas, and it keeps on coming. This chat is a great way for you to expand your network, talk to each other, connect with each other. And if you have any questions, remember, use that Q&A box. We want Alchemizing HR to be accessible to everyone, so we have closed caption running. If you don't want it running, there is around the bottom of the box, a way for you to turn off the closed caption subtitles. So if you would like to do that, just go to the bottom of the screen. Welcome again. I'm Amy Dufrane, the CEO for HRCI, and I'm so happy to be here with you today. We're going to be talking about some wonderful ways for us to build recovery-friendly workplaces. And I am the CEO for HRCI and former CHRO, longtime HR person, and I am a learning person who loves to expand my network and my knowledge on things that are really important to HR leaders out there. Our topic today, again, is building recovery-friendly workplaces, insights, challenges, and HR's path forward. I am pleased to be joined by my colleague, Cathie Hartnett. She is the Executive Director of the Global Recovery Initiatives Foundation, otherwise known as GRI. GRI focuses on the gap in recovery space, which includes the need for more research on recovery, breaking the stigma associated with recovery, advancing community-based recovery supports that include where people live and work. The next slide, please. Oh, sorry. I think I have to turn this over to Cathie, but just a few other things before we get to that. As HR professionals, we know that our work doesn't stop at benefits administration or compliance. It's about cultivating an environment and a workplace that are inclusive, safe, and supportive for all of our employees. This includes those folks that are in recovery from substance abuse disorder, otherwise known as SUD, S-U-D, which impacts millions of Americans and their families across every industry and every region. As a matter of fact, I'd like to see how familiar everyone is in the audience with this challenge. we're going to put up a few polls around substance abuse disorder and recovery to gauge your current knowledge. So please be sure to participate in these so we can gauge the audience knowledge on this. You may have seen or participated in our recent survey conducted in conjunction with FOR's March on the topic of recovery-friendly workplaces. The survey was released in April of this year, so thank you to the more than 1,500 folks that participated in this survey. It's in the resource tab of this webinar, and it's a great document for talking about the voice of human resources and what we found in looking at recovery-friendly workplaces. It's a topic that is important and very serious, and HR professionals are increasingly identify substance abuse disorder as a serious concern in their organizations. The pandemic only brought into further focus. We got lots of insights from the HR community in the report, including additional support that's needed for HR professionals to make their organizations more recovery ready. That's why we're here today, to lead the conversation around workplaces and support recovery to reduce stigma, and how certification as a recovery-friendly workplace can be a powerful step forward. So Cathie, let's begin with the basics here. For those of you that might be unfamiliar, we have this first poll, and hopefully everybody has answered that poll. Here is the answer, or what everybody thought the answer was. And Cathie, I think you have some insight here that you can lean in on.
I know. I was so sorry that at the bottom it said host and panelists cannot participate, because it would have been a test I might have passed.
I love it.
Anyways, thank you for having me. In fact, there's a couple of things I want to just say about this poll. There are 26 million people in this country who have substance use disorder actively. Almost all of them are in the workplace and struggling. And most of the people who work around them may or may not even know that they're struggling with that. But on top of that, if you think about a person who's struggling with substance use disorder, there's probably 2 or 3 people immediately around them who are also affected by their condition. And those people are also in the workplace. So the workplace issue around recovery-friendly workplace is not just for the person with substance use disorder, but it is also for the many family members or close friends who are struggling and whose work product may be influenced by the pressure that they're under.
I think that's a good point, is bringing up that the family and friends that are around that person who's going through recovery, because they're often sort of forgotten in all of that, sort of the research that's done, because those are the folks that are really helping to support and lift up that person through their process through and into recovery.
That's right. And there's also 14. Oh, I better not say anything more.
Oh yeah, don't say. All right, our next poll that's coming up here. And I think we have some folks who are sharing stories in and around the chat. So thank you for sharing your stories. So our second poll is, how much does substance abuse disorder cost employers annually?
It'd be another thing I was thinking about as you responded about family members is that substance use disorder and mental health have both been very stigmatized conditions, right? I always say they both originate in the brain. The brain is part of the body, so they are health issues. They have been often treated as though they were character flaws or choices that people made. And so I think one of the great things that has happened is that the stigma about mental health has really come down, and the stigma about substance use disorder is also getting much better, so that in general, the population is much more empathetic than they were in the past. I always chuckle over with people about the fact that 20 years ago, you would never tell a person in the office that you had anxiety or that you were taking an antidepressant. And now sometimes we brag about them. And in terms of substance use disorder, that was something that people really viewed as, even though the majority of Americans, even 20 years ago, acknowledged it was a disease or a condition, they didn't think it was possible for people to get in recovery. But there are 23 million people in this country in recovery. And so there's lots of recovery that is already in the workplace and in our lives.
That's great. So the answer to our second poll that folks thought the single choice was 62 billion. So Cathie, what's the answer?
81 billion.
Wow.
And those figures are even a couple of years old. So it may be even more. And what those reflect are lost days work, sick leave, people who retraining because people lose their jobs. If you're not a recovery friendly workplace and you can't get people help earlier in the process, they end up losing their jobs. And then that's a whole retraining process. And the toll on family members who often end up resigning from their positions or failing in the workplace due to the pressure that they're under.
Yeah, those are big numbers that we as HR professionals and business leaders need to be thinking about. Like how do I make sure that I'm paying attention to that, because that is happening, in all of our organizations. And how do we make sure to close that gap by thinking about being a recovery friendly workplace?
Joe, maybe it would be great if you put up the slide on the definition of a recovery-friendly workplace, because it might help if I sort of describe how some of this came about. The world of substance use disorder has primarily, the visibility has been around prevention and treatment, right? So everything from the Just Say No campaigns to people talking about people going into a 30-day treatment program or something like that. Over the last 20 years, there's been a lot of development and more research about recovery, because since 23 million people are in recovery, one of the things that was important to researchers, who are they? Who are the people that are successful in getting into recovery? And one of the things that came out of that was two major research summits that GRI held. One that brought researchers and HR professionals and employers and activists and treatment people together to really look at the recovery space. Because honestly, as soon as you reach recovery, where are you? You're out, you're no longer in a treatment program. And most people get into recovery without going to treatment. And so there's many paths to recovery. But when about 4 years ago, the White House Office of National Drug Control Policy put into the National Drug Control Strategy recovery, which was really great, because most of the strategies have been around what I would call the critical phase of the condition. And by bringing recovery into it, now you're talking about all the people who are in the workforce that are already in recovery or need recovery, and we all spend a huge amount of our time in the workforce. So how could we say that the workplace had nothing to do with supporting people in recovery? So the federal government did a toolkit, and part of that process was thinking about what the definition of it is. Some believe that the definition of recovery is sobriety. It is completely non-use. There's a lot of research and a lot of work out there that many of your co-professionals know about, with harm reduction and all kinds of things in that. So we took a crack at looking at, okay, if the gap is in the workplace, what is the appropriate role for the workplace to play in recovery, in supporting people in recovery? So we define a recovery-friendly workplace as a place of work in which the employer, in collaboration with employees, establishes, maintains, and continually enhances policies, practices, and a culture and work environment that are supportive of current and prospective employees in recovery from or otherwise affected by substance use disorder. And that's where we added the family piece to this, or family members. To me, this is a key thing for HR people who will automatically understand this, because you all do it around many issues and healthcare issues every day in your workplace.
So, Cathie, can you talk a little bit more about sort of the next phase of the research that was done? Because that's where HRCI got involved, and we brought a lot of HR professionals
Yes.
to the table, and we're really talking about where are we, it's kind of a state of the state of organizations and embracing recovery friendly workplaces, and what does this look like? Because this is something that the White House is very interested in, and as evidenced by our trip there to talk about being and bringing substance abuse disorder and recovery friendly workplace to the forefront.
Yeah. So, and the really exciting news, which I don't think any of us are unaffected by the highly politicized world we live in right now. I am so pleased to tell you that recovery in the workplace has been a completely nonpartisan issue. We've had equal support from every single administration since we started working on this. So it is not a Democrat or Republican fight. There is tremendous unity around this need to address recovery and to find better ways to support people in recovery. We asked Forrest Marsh to support us. It's a research, marketing, communications firm based in Washington, and they were responsible for the COVID vaccine campaign. So they do a lot of work in the health and wellness sector, and they did 2 surveys for us. And the first survey was the first survey that we're aware of that interviewed employees who were working full-time in the workplace about their attitudes about people in recovery. And the results of that survey were really interesting because we were actually a little surprised. There was substantial, well over 60% of workers said they knew what recovery was. They were very supportive they had no problem working next to someone who was in recovery. They were very supportive even of a person who was struggling and needed help. If they heard from supervisors, their direct supervisors, on a regular basis about non-stigmatizing language and so not making jokes about people who are drunk, or not making those kinds of stigmatizing statements. If they heard regularly about recovery being something that the workplace cared about, they were more likely to go to their immediate supervisor and say, either I'm worried about a coworker or I'm worried about myself, and reaching out for help, which for us meant we might get people earlier in the process. One of the things they did say that they were very scared of was they were afraid to go to HR with any of their concerns for themselves, their family member, or anyone. That led us to you, and HRCI was so open when we went to them and said, would you all be willing to help us with this next research project that Forrest Marsh wanted to do, which was to really find out where HR professionals are on this topic and where do they do, because very often people can have attitudes and they're based in their attitude. That's not based in reality of what is really happening. So HRCI participated in this survey by providing us, and thank you any of you who are in the audience who participated and to help us do that. And then they did a recent report, which is available to all of you. And HRCI has now really become the leader in the discussion of the workplace about what is the role of HR around SUD and how can the HR community help us get better at that. That survey showed that we really needed to do more education, that there wasn't a lot of knowledge. I think mental health has been ahead of substance use disorder in sort of the HR field in terms of getting materials and policies and all kinds of education programs and things like that. And so for us, that meant we really needed to get ahead of this. So that is part of the reason that after the federal government decided to develop a toolkit for employers and put it on the Labor Department website, and we wanted to expand what that toolkit could do by including employers, we created this National Institute for Certification. And it's really the Recovery Friendly Workplace Institute is going to be a sort of a a holding tank for lots of ideas and programs and best practices that many HR people around the country are already doing, but a place where people can go. And we developed a certification program, but we included people in HR and who are employers in the development of the certification document, which was something that wasn't particularly part of the toolkit. I will admit, I think the toolkit might be 125 pages. I'm sure everyone goes to the Labor Department the first thing in the morning to look at what new and exciting massive document they have for you to review. So we've kind of tried to make it a more employee-friendly process and have developed this certification. But but what we know is that HR is critical to this. And we've now certified our first group of companies and have discovered some things that I'll share with you as we have this conversation that HR professionals discovered when they were going through the certification process. But maybe I should just say, and I think many of you will know this, but Joe, if you'll show the next slide, I just want to show you a couple of things that might make sense to you as you think about all of this.
So while the slide's coming up, Cathie, can you remind people where they can find the toolkit that you're referencing? What do you know specifically where that is? And just again, it's long. It's a hefty document, but it's a great place to start that conversation, right?
It is also, it is the most researched and validated, truly researched and based on that toolkit has. And you can get it by going to the rfw.org website, and you can get it off the Labor Department website. So that's places to do it. And we'll also provide it to you all so that you all can have it available to your people. But one of the things that came up is we were really looking at the HR survey that was being done and learning what we needed to make sure people understand. So why recovery-friendly workplace? I mean, many people think of this as, okay, so a person is sick, so they go out and they get treatment somewhere and then they come back to work. But if you think about multiple health conditions, there are always elements in the workplace that affect those health conditions, right? So why the workplace for recovery friendly? People spend the bulk of their time there. Substance use in the workforce is widespread. Untreated substance use disorder is very costly, as you saw with the $81 million. And adopting RFW policies is good for business and good for employees. There is a survey that shows that people in recovery in the workplace have fewer lost days work and are higher producers than their peers. And so recovery is actually an asset to an employer to have a person in recovery in their workforce. Next slide, please. So with 14 million employees already in long-term recovery, they are already working in the workplace. Some employers have said to us, well, I'm very empathetic, but we don't have any people in recovery. Well, because of the history of stigma around recovery, many people do not self-identify. If you've been in recovery for 10 years, if you've been in recovery for 20 years, of which there are many people who have, you might not even mention it. And partly because one of the most well-known sort of recovery systems out there is AA, Alcoholics Anonymous. And Alcoholics Anonymous is an anonymous program. The anonymity of it is not necessarily that you can't talk about being in recovery, but you don't talk about what happens when you are in an AA meeting. So that has created sort of a culture of anonymity that went beyond what the rules of Alcoholics Anonymous is. So for sure, you have people in your organizations who are in recovery, and they may just not have come forward and said that they were. So 2/3 of U.S. households are affected. That relates partly to the family situation, and you saw those numbers. So the next slide. So here's the benefits for being a recovery-friendly workplace, which has been validated by the work we've been doing with employers as we started this certification process. Productivity is improved, employee health is employee satisfaction and morale, community connection, because part of recovery is making it okay. I'm going to give a perfect example. If everybody goes out for a drink on a Friday night after work, sometimes people, if they know a person is in recovery, they don't invite that coworker to come. That's contrary to what a good culture in a company is. It might be that you might choose a place to go out for a drink that also has pool tables or has some other things to do, so that it's not just about drinking, but it's about community. So the community connection is really important. And when it happens, it works really well. And customer loyalty. The benefits of, and so absenteeism and presentism, I had to learn that word. Workplace injuries and incidents are reduced. Healthcare, disability, and workers' compensation expenses are reduced. Turnover and related costs are reduced. And harm to employees, families, and communities is reduced. So there's a lot of good that can come out of this. And one of the companies that we've been working with is a major manufacturing company. And one of the data points that they gave us is by becoming a recovery-friendly workplace, they saw a drop in calls to their suicide hotline, a drop in ER visits, an increase in people seeking assistance, which their CEO and head of HR said that's progress, because that means while the person is still able to work, we're having an intervention. We're getting them help so that we aren't waiting until there has been multiple disasters, right? And so they saw that as significant progress in what they were doing. So that's kind of that. Does that sort of give you a sense of the reason that this is worth an employer spending some time looking at?
I think it's a great tool for us to see what those benefits are for organizations that have and are becoming, they're on the path of being a recovery-friendly workplace. I think it's a journey, right? It's not a that you're there. I think organizations, what you've created and you're going to talk about is sort of how do you help organizations become a recovery-friendly workplace? I know I've talked to HR folks. I recall a conversation that I had with the CHRO of a very large organization who had an employee who they didn't know was in recovery. They sent the employee overseas on a job to do some work there, and put them in an environment that was not a recovery-friendly environment. And as a result, ended up having to bring that person back to the US in an emergency way. And so because of that, they realized we've got to be an environment and a workplace that is recovery friendly so that we don't find ourselves in that predicament again, that we're supporting the employee who is in treatment, in recovery, and that we're setting them up for success to be a productive member of their team. So I think that was something that really hit close to home for me, because that's, wow, an organization that this has been a transformative experience for them, of a learning journey that they had in particular around one employee who was in this recovery, and they didn't have that workplace at the level where it should have been.
That's one of the reasons that the White House asked GRI if we'd create an institute that really focused on recovery in the workplace, because although the feds could put together this toolkit, how are people going to use it? How are we going to access it? And it's been a really interesting journey for us because of so many examples that you're giving us, that we're getting, just like the one that you just gave of this is not coming from a place of we don't care about these people. It's coming from a place of, wow, this has been such an underground condition. And I think that COVID and the opioid crisis combined has sort of brought this to a bigger level. And Amy, you really educated me about what changed in the HR field with COVID, and CEOs actually for the first time. The U.S. Chamber told us it was the first time they had CEOs coming into their meetings and saying, I'm really worried about my employees' mental health and substance use disorder.
That's right. And I think that was HR's call to continue to lean in on this particular topic around mental health, around sort of the whole COVID situation. And we really broke ground with the C-suite and demonstrating our capacity to really help the business think about their employees in a very different way. So I think that's, really a transformative time, one that we as HR professionals learned from, and one that we're, continuing to navigate through, with all of the different sorts of changes that continue to happen each and every day around us. Cathie, I was recalled when we were at the White House, and we had some amazing people who shared their stories in full transparency about their recovery-friendly journeys, where they started as an organization. And so it was both organizations and associations. So we had the flight attendants, we had construction management associations talking about the cost and the issues around not having recovery-friendly workplaces, and what do you do to try to support that? And then some of the organizations that have invested, and it's not a lot of money that it takes to invest in being a recovery-friendly workplace. So can you talk a little bit about some of those stories that we heard at the White House of just those amazing people who really bared their soul in some cases about their journey?
And all of them were employees of employers who had started programs within their in their organization. Dana Piscopo was there from Oracle, and how she wasn't in HR, but she got involved, and then HR got involved, and they have these amazing programs that just by having not an official affinity group necessarily, some places have real affinity groups, others just have educational programs or chat groups, and how many people started to come forward and talk about how much safer they felt about sharing who they were and what they were, and how they started to lose their fear of saying to a supervisor, this time of day is hard for me, so I may need to take a break, or just asking for the supports they need. The other thing that these companies really shared with us after the White House is that they said to me, you need to tell employers about the fact that your certification isn't a nightmare. That it doesn't take a team of 20 working for 6 months, and the certification process feels like they're going to catch us and we're not going to get certified. We are sort of the opposite of that, because the wonderful thing about recovery is that when a person reaches recovery, they are no longer an expensive patient. They are not in an expensive medical care situation. And so our certification developed with HR professionals helping us think it through, and it has 4 pillars: culture, education, benefits. And many of you here already have worked for companies and employers who have benefits. So benefits would be sort of the most expensive. So education and awareness, and hiring, retention, and advancement. And I will tell you that I think we're up to 4 now, of the first 15 employers who got certified, the people who led that in their organization have been recognized by their CEO and have gotten promotions, because it was a significant contribution to the employer to really advance recovery-friendly workplace. So our pillars are, how do you change the culture? HR's people are experts at dealing with this kind of thing, and we have lots of tools for you. Hiring and retention, you're very involved in that. You track it, you know it. Benefits, you know all about. One of the things that came out at the White House meeting, where we had this roundtable of employers, was that Oracle, I don't think would mind if I said this publicly, because she said it publicly at the White House. When they were going through the certification process, they uncovered some offerings that were actually in their benefit package that nobody knew because it was in a back file somewhere and the insurer had never really brought it forward, or the EAP had not brought it forward. And there were things that were being covered that they didn't even know they had access to. And so one of the things that certification does is help employers sort of dig into their files and see, are we getting everything that we should get? And are we getting everything we're paying for?
Cathie, I think that's a really good point. I'm really glad that you reminded me of that, because it was sort of like in those gigantic terms and conditions that we have in all of the healthcare plans that all of our organizations have, they do have these pockets of things that you're like, wow, I had no idea that was part of the plan. So looking at those carve outs that that organizations, the health insurance companies have identified to help, are really helpful for us as HR professionals to dig into and ask those specific questions as we're going through open enrollment. I know some of us might be going through open enrollment now, more of a minority of us, but as the fall kicks in, we'll be going through that. We can specifically ask our health plans, what is the coverage look like for those folks that are seeking help, that need help, or that are in recovery. So asking those specific questions, I think this is how we can start to push that insurance companies are saying, oh my gosh, this is really important to HR. And we do need to raise that level of conversation that we're having with our business leaders about what our insurance companies are covering.
Well, and this institute that we've created, which is only about a year old, a little bit over a year old, when we dove into this, one of the things that we realized is that the recovery movement has been, and the substance use world has been, either direct treatment and advocacy and things like that, but the employers weren't really being included in the discussion about how to do this. And as a result, I had people say to me, HR professionals say to me, I really want to do something about substance use disorder, but I don't know how to manage a person with substance use disorder. I don't know what I can do to help them. What can I do to help them? And it was a really interesting conversation, because the truth of the matter is, you don't have to take care of a person with breast cancer. You just have to give them access to those services, right? And so I think that some of the stigma about substance use disorder and mental health can be confusing to even well-seasoned HR people, because you sort of wonder, what is my role? How do I support this person? And part of what our certification process is in getting more companies to create recovery-friendly workplaces is to sort of normalize this as a standard health issue that you are dealing with, along with all the other issues that you deal with your employee base, rather than it having too many unique elements to it that make it feel onerous to take on being a recovery-friendly workplace. So the culture piece of it, I have great examples that employers have now given us. It's things like making sure that there's mocktails at an event, and that it isn't necessarily a separate place where the mocktail is. And maybe the other option other than the mocktail isn't just water. And so really making that event feel welcome. One employer decided that they were going to have their executives come for sure they were going to engage their leadership to come for the first half an hour and all taste the mocktails, to sort of, create a culture that says you are still welcome here to order something that isn't alcohol, so that people, by modeling behavior, are not saying things that weren't intentionally bad, but come on, Bob, have a drink, a different sort of approach. There are others that have created programs where people who were open about their recovery were willing to do a webinar or a panel discussion for an education program and talk about that. In one company, there was a group of people who had mental illness speak, and there were people who spoke about substance use disorder. Immediately following those panels, those employees got calls and texts and emails from fellow employees new people came out and talked about their fact that they were in recovery, and then all of a sudden it becomes more normalized. So these are culture changes and education changes. These are not highly expensive, highly technical. We have great examples of policy that people can use by having very clear communication with your employees about what are the consequences if you have substance use disorder and it impacts your work. What are the steps? How can you come back from that? So second chance policies, all these kinds of things. And now there's some pretty good samples of good policy. So we hope that the Institute can be a place where people can get good ideas about that and how to do that. And HRCI is one of our first 15 certified employers. So I don't know, Amy, if you have any thoughts about that, the process you all went through and whether it made you feel like, uh-oh, another thing on my plate versus, oh, we could do this.
So first of all, we're honored to be part of the first 15 to be certified, because we at HRCI want to be an organization where people feel comfortable either letting us know that they need help or that can be in recovery and share it with their colleagues. And I think we have demonstrated that. I've got colleagues who are sharing that with their colleagues openly. And we went through this process because I believe in it. I believe that it's important to be a place where everybody can be their authentic self. And at HRCI, it was a journey for us because this was new for us. We didn't have this all figured out, but I thought this is a way for us to be representative of a passionate group of individuals that want to make sure that we have an environment that is inclusive and where people are feeling that they can be their authentic self. So our HR team went through this process, and it was a learning journey for us. We went through training and education courses. We went through a process by which we had policies. We communicated that to the team. We're talking to our insurance companies and our employee assistance programs. So we're, going through this process of going and being a certified recovery-friendly workplace because we felt like this was important. And I can attest for the team that this was not it. Of course, it does add to the list of things that you have to do. I don't want to be Pollyannish about that, because it certainly is something else, but it wasn't we at HRCI, one of the many things that we do is participate in ISO standards, and we certify organizations against the international standards organizations, or ISO standards. And those are more, there's a lot more sort of standardization in that, and it is more robust. Not that I'm saying this isn't robust, but you have to demonstrate that with ISO standards, where this, I think, is a learning journey for an organization to go through to really say, oh gosh, I don't have that yet, but I'm going to go to GRI's website. I'm going to borrow some of those policies, think about how, recraft them based on my culture and what makes sense for my organization, and integrate those into in our case, HRCI. So I think this has been a great journey for us as an organization to go through. And I think it has empowered people who are in recovery to talk about that because they feel comfortable and know that we are very supportive of their recovery efforts and that we will help them.
So thank you. And so this slide shows when we did our initial certification, and we are now, I think, up to 19, we actually did it sort of by invitation because we wanted to test the model. And so we have privately held companies, we have family-owned companies, we have unions, we have associations, we have manufacturers, we have Fortune 500s. We have a couple of organizations that primarily just work in their states. We have sort of two pillars. One is national certification, which we're very focused on to get any employer who has multiple state operations so they can get one certification. That was something we learned from HR people. They said, please do not make us get certified in every single state with a different certification in every single state. Do a national certification. But we are also working with states. So the state of Colorado, New Hampshire led the way. This governor of Minnesota has just put out an executive order. So we've had Republican and Democratic governors launch this in their states, and we are helping to get statewide organizations so that if you're a mom and pop shop, or if you're a small company that only operates in Nebraska or Connecticut, and you want certification, it'll be built off this national certification, but then you can have that local certification as well as the supports. We even have developed supports so that is partly what we're trying to accomplish here. And for this first round, we really wanted to do a mix of industries so that we could learn from it. And now we've been asked to open up the certification. We're a little scared, but we're a little scared to open it up. But one of the things we've said is anyone who is connected to anybody that we've certified, like HRCI, we are very open to working with you to get you certified. So any HRCI audience out there, if you think your company is interested in this, we're happy to talk to you about it. But that was sort of our process, because we want to get it right. And we are also have an advisory committee. We have a corporate council. We are creating structures where employees, we do an initial staff review of the certification, but then we put it in front of certified employers to look at, what do you think of this? And we use a point system because different people do different things, and we want to take advantage of that. The purple on this state, on the map of the US that you're looking at, are states where there is something going on. And because of the federal cuts, this was a NIOSH at CDC map where you could click on the state and find out what was going on in your state. We've taken that over because the funding got cut for them to be able to do that. So this does not mean that all these states have recovery-friendly organizations statewide. We're still in the developmental phase, but there's something going on in all these states. So we're happy to help connect you to people in the state that are doing this. And I just feel like HR is so critical to what a person experiences when they come to work for a company. And one of the things that some people at LinkedIn said to us was, wow, if you're a person in recovery, or if you have a family member who's in recovery and you're looking for a job, and you see a recovery-friendly workplace certification seal on their corporate website and on their LinkedIn people you're checking out, you are interested in working for that company. So when you go back to those big numbers we gave you about the number of people that are impacted, this also will ultimately become a good kind of recruitment tool to get employees.
Super, Cathie. We, at this time has flown by. My gosh, we have lots of questions.
Okay.
That I'd like to get to. First is quickly, what substances fall under substance abuse disorder? Gambling, narcotics, alcohol. What is that definition?
Yeah, I think all of them, any addiction kind of thing can fall under this. I would say that our expertise and the big numbers that you're seeing that we've given you have to do with alcohol and drug. Okay, so they're not the gambling numbers or the sex addiction numbers. But I will tell you that what we've learned about addiction is there's often crossover addiction. So when I think about stigma, when I think about services that you would provide, if your EAP is providing counseling to people, hopefully they'll have counselors that can cover all those things.
Thank you. So another question is, you mentioned SUD as a family disease. Is it in our scope in HR to figure out how to support families in addition to the employee? And if so, how can we do that?
Well, I will say culture and education are the most powerful tools. If you have employees who either have substance use disorder that need help, or you have employees who have family members, if they have heard from you, and the survey that Forrest Marsh did first for us before they did the HR professionals showed that if you were regularly communicating language and openness about this, there was a far better chance that an employee would reach out and say, okay, I am so stressed out because my spouse is in trouble and I need to learn what the benefits are because my spouse is in trouble and I need to get them help, or my kid or something like that. But just being able to feel like you can tell the truth to your employer about what's going in your mind, I think can help you stay productive in the workforce. So there's that. And if people believe that HR has compassion for this, which doesn't mean that you give up drug testing, because we know that drug testing is something that many of you are required to do or is a policy that you have, but drug testing as a way to help people in a cultural way versus drug testing to gotcha, that's a perfect example of how drug testing is used in an organization. So it's not that we're asking people to turn their policies upside down, but we are asking them to think about developing policies that have that are culturally relevant and health oriented, and really give people paths to get the support they need. We even tell employers it's important to know what your local services are available, because there will be some people who will say, I'm too scared to use my insurance for this, or I'm not ready to tap my insurance. But if there's lots of information in the workplace about where there are support groups, where there are assessments that can be done, where you can get community services, that's another way that the employer is then showing its employees, we're interested in them getting help. We're interested in them getting the services they need.
Cathie, I don't know the answer to this question, but somebody was asking, is there an industry that's most likely to have substance abuse issues? And are there any studies on that you could share with folks?
Some of this really showed up in the opioid crisis. So the construction industry hit very hard. The manufacturing industry hit very hard. Industries where there are high probability of possible injuries, right, in the workplace, which then led to people getting pain medication, which led to abuse of the pain medication or not getting the proper supports for it. And so those industries have been heavily impacted. But I will also tell you that I have met with technology companies and Wall Street companies who've said there's plenty of substance use disorder in our industry, and some of it is part of the pressure of the workforce. Some of it is sort of just a culture of entertaining a lot and doing things like that. But they say it's really everywhere. Some places it just shows up faster and has to be dealt with more quickly than in others. But if you think about the fact, if you just look at the total numbers, it's going to be very hard for there to be an employer who never has a person in their workforce that is not affected in some way, either as a family member or person.
So this question is it's a harder question because this person is being faced with conversations about alcoholism being a disease. And she has people that are saying, but cancer and MS isn't a choice or a decision as to whether or not they have cancer or MS. Do you have any advice for this person on how do they handle that conversation with that employee who may say, what is that? Why is this a disease?
So it is absolutely a scientific fact that it is a brain disease and a brain condition. People do not choose to have mental health issues, and they do not choose to have addiction or substance use disorder. And this has been medically research studied. There are people that can show you in the brain how the brain is developed and what part of the brain is affected by what kind of will stimulate this. It is hereditary, not always hereditary, like every other sort of health condition. But one of the stigmatizing things about substance use disorder and mental health to some degree is that somehow this person made a choice to do this or has a choice to stop. And the science has been around for almost 30 years, but the stigma continues. There is a presentation that we can give, maybe we should bring it to HRCI one time, about that is, I love this, brain science for the layperson, right? So it was the best explanation I ever got, where a doctor presents how chemicals affect the brain and how addiction is created. And the tough part, honestly, about substance use disorder is it has very unattractive symptoms. And I don't say this with any lack of respect, but if you feel sick and you're lying on the couch and you're quiet and you're taking a nap, that is a symptom of a whole lot of illnesses, right? Or a whole lot of health conditions. Substance use disorder has, because it's in the brain, often has very difficult symptoms for people to deal with. And so it makes it harder to break through the stigma that this person is not choosing to behave the way that they're behaving. I don't know if that
Great.
helped.
That was great, Cathie. A lot of people were in the chat saying spot on. Thank you very much for that. Very, very helpful. I think another question is that somebody was looking for some concrete examples of coworker behavior in a recovery-friendly workplace. We talked about sort of the mocktails and happy hour. Any other ideas? And people can put them in the chat to share with somebody who's looking for what are some of those ways that people have found, and just, they may be small, but very helpful ways to, really include people who are going through recovery.
So I'll tell you things that I've heard from people who are going through recovery in the workplace as well as family members. So a person saying, I'm in recovery, getting asked a lot of questions about what kind of substance use they used. So, did you use heroin? Did you smoke pot? Did you get drunk every night? How much did you use? Those are painful. Those are less supportive versus than saying, wow, tell me how your life has been since you're in recovery. And how can I support you if you're having a bad day? If there's things that trigger you. For a family member, I've had many parents say to me that they wish they could tell their workmate how concerned they were about their child or their husband. But very often the response is, well, are you going to divorce him? Or they get the look of, you must not be a very good parent. All of these go back to the stigma about substance use disorder and mental health, right? And so what people need to hear is, how can I help you? How can I support you? And not necessarily and try to figure and speak their honest truth, saying, hardly anybody has no one in their life that hasn't experienced some kind of substance use disorder. So being willing to share your story, being willing to tell, when someone tells you their story, say, I had an uncle who had a real problem and it made me really sad. Or just being able to normalize the conversation. I'll use breast cancer as an example. 25 years ago, when I was working in Washington, D.C., there was a woman in the White House who, maybe it's 30 years now, I'm getting so old, who got diagnosed with breast cancer. You know what the advice to her was? Tell absolutely no one. You will be pushed out of your position. You will stop being given assignments. Because it was perceived as, if you have that, you're a goner, right? So today, people are marching with each other in walks for breast cancer. So what we're trying to do is normalize substance use disorder as something that many, many people face, and recovery is possible, and we can all be part of supporting that recovery.
That's awesome, Cathie. This has been such an amazing discussion. We're coming to the top of the hour. We know that HR professionals have, very scheduled, busy lives, right? Here is Cathie's contact information, open invitation for anybody who's interested in getting certified. She said, if you're part of the HRCI community, you're game for coming in and getting certified. That's right. You've got special access. So we invite you to reach out to Cathie and her team. And I think the reason why she said we're a little nervous about coming on here because we're going to have the onslaught of people who are really interested in this. And I think she's right, but we're here to help, Cathie. We're part of your community.
It's
so
the best kind of problem.
help.
It's the best
Exactly.
kind of problem. And won't it be thrilling in a year from now when we can say, because of the work of HR, there are now millions of people who can go to work every day knowing that they are accepted and that they are included and that they don't have to keep a secret.
That's right. Well, Cathie, thank you again so much for being here, and to our sponsor, Ethico, who helps us to bring amazing content just like this to you each and every week. So please keep an eye out on your inbox for some great announcements that we have on HRCI Engage. If you're not part of that community, we encourage you to. We're topping the 9,000 person mark in people who are engaging with us on a regular basis. This has been out there for about 90 days. So if you're not part of it, go to HRCI Engage and find out more. Keep on learning. I am just the biggest advocate of this throughout my entire life. Is I love to learn, and you can learn more about HRCI getting our newsletter. We have learning courses. We certify folks. We've got 220 learning courses. We've got just ways for you to connect with this wonderful HR community that will help you to navigate all the challenges that we face as HR professionals. We couldn't get through all the questions. We're going to have an after event. Here's the Engage community. So go to Engage, 2:00 today. If you go to hrci.org/engage, we're going to have 30 more minutes with Cathie, answering questions that you might have. She's a plethora of information on this topic, can help